Hello. Having diabetes shouldn't stop you from enjoying your holidays. The key is to plan ahead, allowing you to deal with any potential problems and seek early advice if necessary. Whenever you travel, take a copy of your repeat prescription. If you are flying and use injectable medications, ask your practice nurse or diabetes nurse for a letter explaining that you need to carry needles in your hand luggage. Remember to pack all of your diabetes equipment, including your glucose testing meter and strips, finger pricking device, and needles if necessary. If you are travelling somewhere hot, take a cool bag for storing your insulin and injectable therapy, and write down some useful diabetes phrases in the local language in case of an emergency. If you inject insulin or other medication, it is important too. Keep all injectable items in your hand luggage in a transparent plastic bag, including needles and syringes. Be ready to show your prescription and nurse letter to airport security. And if travelling with others, share your medication with them in case your hand luggage is lost or stolen. If you are taking treatment that can cause hypos, carry glucose with you at all times, such as glucose tablets or jelly babies, and carry starchy snacks like biscuits in case of travel delays. If you are travelling with an insulin pump, then your nurse will be able to advise you about going through body scanners in airports and crossing time zones. If you are travelling on a long-haul flight, you may need to adjust the timings of your insulin injections. If the time difference is less than 4 hours from UK time, there's no need to change the times you normally inject. If the time difference is greater than 4 hours, you will need to alter your injection times. This table will provide some guidance, but your diabetes nurse will always be able to offer further advice. Be aware that if you are eating differently and doing different levels of activity, you may need to adjust your insulin based on your blood glucose levels. Alcohol and increased physical activity can increase your risk of hypos. Always wear shoes, even when swimming in the sea. When you have diabetes, cuts can quickly become infected, and if you have nerve damage due to your diabetes, you may not be aware of an injury. If you become unwell, your glucose levels are likely to rise. In the event of illness, check your blood glucose at least every 4 hours. Check your ketones if you have type 1 diabetes. If you are unable to eat meals, eat easily digestible foods like ice cream. And be aware if you need to take insulin, you will need to increase the dose if your glucose levels are higher than normal. The key is to plan in advance. Contact your diabetes nurse or GP for further advice before you travel.